Hello, hello, hello. Hello, people. How's it going? Happy Thursday. Happy Thursday, happy Thursday. Let me try and pin. I've been copying and pasting all day, and now, of course, it's not pasting. If you guys can add the pin for me, that would be great. Hey, guys, it's Thursday. It's our Lives with Whitman-Walker. We're having a special Q&A today about COVID-19 vaccines. So come on in and stay tuned. We have a special guest today. We'll be talking about the COVID-19 vaccines. So stay tuned, stay tuned, stay tuned. Hello, everyone. Let me wave at some of you. I miss a lot of you. I miss all of you, actually. View request. I think we are in. Hello, hello. How are you, Dr. Henn?
I'm doing well, Orlando. Thank you for having me.
Thank you for being on. This is our first time together, so welcome, welcome.
Nice to meet you.
You
Even
as well. Thank you so much. We're going to wait a couple minutes for people to join us, and let's get all set here. So, for those of you that don't know, I'm Orlando, one of the social media influencers with Whitman-Walker. I've been with them for about a year now. So we do a lot of these conversations on different topics on health and mental and things that we can help for people just to stay sane and talk about, testing, COVID-19. Today is a special day. We're going to have a Q&A with Dr. Sarah Henn about COVID-19 vaccines. So as I said, I'm Orlando. My pronouns are he, him, and his. And I'm sure you are all aware of COVID-19 pandemic. It's still raging on. So far in America, it has infected over 13 million, killed nearly 275,000, and disrupted society in an unprecedented way. We already have a number of measures to prevent the spread of disease, from masks to social distancing, but all eyes are on another more elusive prize, a vaccine. A few companies, including Pfizer and Moderna in the United States, have announced that they have developed a highly effective vaccine that will start rolling out as soon as possible, maybe even before the end of the year. These announcements are exciting. They also raise a lot of questions. So today, joining me is Dr. Sarah Henn, who can tell us a little bit more about COVID-19 vaccines. Dr. Henn is the Chief Medical Officer at the Whitman-Walker, where she has worked since 2007. She is a board-certified physician in both infectious diseases and internal medicine. She also holds a Master of Public Health degree. So please be super excited that she's here with us today. I'm encouraging everyone to tune in, ask questions, speak up, don't be shy. And if you can't ask them now, ask them later. Dr. Henn, would you like to introduce yourself, please?
well, I think you did a great job, Orlando. It's my pleasure to be here. I'm Dr. Henn, Sarah Henn. I also use she, her pronouns. And I've been honored to be a physician at Whitman-Walker coming up on 14th April. And certainly over the last year, we've experienced something like we never have experienced in our lifetime. So, it's exciting that we now, even in these dark days where we're having record numbers of infections and deaths, we also have something we can look forward to, and that's the authorization of vaccine. So I'm excited to answer questions. Really encourage everyone to ask their questions.
Beautiful. Yeah, so don't forget, ask questions. You might hear the questions that I'm going to ask as well, but don't be scared to ask, because if we touch the subject, great. If we don't, we'll have more questions to answer. All right. Well, let's get started. Question number one. Let's start really broadly. What is a vaccine, and why should I care about the COVID-19 vaccine?
So, I think all of us have probably had vaccines before, but really simply, a vaccine stimulates your immune system to make antibodies to a disease, just like your body makes antibodies if you've been infected with that disease. And so ideally, what happens with a vaccine is it protects you from ever getting sick from that infection. So we should care about the COVID vaccine because it will not only protect us from infection, but by protecting your yourself, you can protect those around you, particularly those who are at increased risk of severe morbidity and death from the virus. And I think, what we're seeing with COVID is, unlike many infections we're familiar with, there's a broad range of symptoms. So people really are getting deathly ill, but a lot of people are asymptomatically transmitting that infection without knowing it. So therefore, it's so important that once there's a vaccine, that people do get vaccinated to protect, everyone in community.
Wow. And yeah, most of the we had a live about the symptoms, that they're pretty much like any other cold or flu. The symptoms are so common that it could even be another STIs, that we think we have a flu, or we think we have an STI, we're getting tested for one, but we don't think that it could be something else.
Right, absolutely. It can, COVID symptoms can mimic a regular influenza. They could mimic acute HIV infection. They can mimic just having a sore throat. That might be an STI, but it could be something else. So,
Crazy. All right. So question number 2: what is the status on the COVID-19 vaccines? How many are there? Are there any major differences among them?
well, so there are really two leading contenders that we get emergency use authorization very quickly, and that's the Pfizer vaccine, Moderna vaccine. Now, there are other vaccines also being developed using different technologies, but they aren't as long and are still in earlier stage trials. But the two we've heard some results for are very similar. They're both messenger RNA vaccines, and that's really a new technology and really exciting culmination of a lot of work that's been done over many years. So what these vaccines do, both the Pfizer and Moderna vaccine, they use the genetic code from the virus to, in the lab, construct a short piece of messenger RNA that codes for the protein, that spike protein we've all heard about on the surface of the vaccine. And then they package that messenger RNA kind of a fatty lipid, and when that is given as a vaccine, that messenger RNA goes inside your cells and instructs your cell to make that COVID spike protein. So without having to actually give you the virus or give you a killed virus or an attenuated, changed, weakened virus, they were able to trick your cells into making that spike protein. And then your body sees that spike protein in your blood and says that's foreign and makes antibodies to it. And then those antibodies go on to protect you from ever getting infected with the actual virus. So that's the idea behind it. And it's really an exciting new technology. And I think the big difference between these two vaccines is really the storage they at this point. So they both look to be really amazingly effective, 95% effective from the preliminary data we've seen from both studies. But the Pfizer vaccine does require ultra cold storage, so negative 70 degrees Celsius. So this is not your home freezer. So that is tricky in terms of delivering the vaccine. Those types of ultra cold freezers, most large hospital systems have them, research centers have them, but they aren't the type of freezer you see in your local CVS or community health center, although at Whitman-Walker we are lucky enough to have a few of those because of the research we do.
Right. Wow. That's good info. So let's see. What's the next question? So will the COVID-19 vaccine be safe? Do we know if there are any side effects? Can people with HIV or other comorbidities take them?
Yeah, so the Pfizer vaccine, we got to see the FDA's detailed report earlier. Really went in detail about what side effects and the profile of the vaccine. And they had no life-threatening major side effects in their initial trial. And the trial included close to 40,000 individuals, half of whom received the vaccine and half of whom received placebo. And the most common side effect they saw was pain at the injection site. So most people, I mean, if you're stuck with a needle, not surprising, right? Pain at the injection. Right. So somewhere between 75 and 80% of people said they had some pain at the injection site. Only 5 or 6% said they had swelling and redness at the injection site. But there were, some systemic symptoms. So, up to half of people said they felt tired the day after the vaccine. They had a head, somewhat fewer said they had a headache or some muscle pain. Rarely 3 to 15% said they had a low-grade fever, and very, very rare uh, nausea or vomiting or diarrhea reported. But generally, those side effects were really the day or two after the vaccine, and then they completely resolved. So really encouraging that this vaccine appears to be safe. And I guess the other thing, we should realize is that safety, we're going to continue to monitor it, not only for the people who are in the trial, they're continuing to get follow-up for up to 2 years, but as we go about giving people the vaccine, we will be required as providers to report any vaccine side effects to the FDA. And the CDC is also setting up a program called VSafe, or Vaccine Safe, and it's going to be something that people can register for and get text messages. So daily text messages after you've gotten the vaccine, where you can text back any symptoms, and then weekly for the subsequent 5 weeks, and then monthly check-ins for up to 6 months. So the CDC does really want to closely monitor people as they're getting the vaccine. So if there are much rarer side effects that weren't picked up in the initial trials, that we will identify those and know about them as soon as possible.
Okay, and it looks like we have a small question. Let's see. Omar asked, since the FDA committee just voted to recommend emergency authorization use of Pfizer and BioNTech vaccine, when do we expect the general public will have access to it?
So it'll be a little while. So we know, the initial shipments will be shipped next week. So DC has already been told that they will be receiving a little under 7,000 doses of vaccine in their initial shipment. Because this vaccine requires ultra cold storage, and because there's such a limited supply initially, those vaccines are going to be going to the major hospitals in DC. Initially they'll be frontline workers, people working in the emergency rooms, the ICUs. Those are going to be those healthcare staff and support staff working in those environments are going to be the first in line for this vaccine. But DC is expecting to receive shipments weekly of vaccine, both the Pfizer vaccine initially, but the Moderna vaccine probably a week or so afterwards. And we expect the number of vaccines that they receive to increase dramatically over the next several weeks. But I think we can, DC has about 83,000 healthcare workers. Those are going to be the first people who are going to be offered the vaccine. I think it's going to be making sure those frontline employees get vaccinated. It's going to take a couple months. So hopefully by late winter, early spring, we'll start to see vaccine available to the general public.
Okay. Nice question, Omar. Thank you for joining in. So let's see. The next question I have for you is we talked about that. When will the vaccine become widely available? Will some people get the vaccine before others? So I guess in this one, we're really just asking, will it cost any money?
Yeah. So let me also talk. So healthcare providers will be offered the vaccine first, but then we're also, the DC Health has said that they are going to be following recommendations of the CDC and vaccinating those who are at highest risk of death or serious illness. So nursing home residents, nursing home employees will be at the front of the line, and then people, with comorbidities who are older than 65. And so exactly how that will break down is that, people who are at increased risk for severe will be offered the vaccine first. And then in terms of will it cost money? No, it shouldn't cost money. So we will be vaccinating people for free. We've actually signed a legally binding contract with the district, promising that we will not charge at all for the vaccine, and others have as well, particularly early on, where all vaccine is being distributed really through the states and the cities. So no one should have to pay for the vaccine.
Well, that's good to know because I'm sure a lot of people will shy away from trying to get a vaccine if they think they have to pay for it because they don't have, resources or are able to pay for it out of pocket.
Yeah,
That's
absolutely.
really good to know. So let's see. Now, why might I have to go back to get a vaccine twice? And what happens if we don't go back for that second shot?
No, that's a great question. So both of these vaccines, both the Pfizer vaccine and Moderna vaccine, require 2 doses. So there is evidence from that we've seen from the Pfizer vaccine, and I suspect we'll see similar evidence from the Moderna vaccine, that people start to develop initial immunity to the virus as soon as 10 days after the first dose of the vaccine. So the second dose of the vaccine is really a booster dose, and it's really designed to strengthen your immune response to that initial vaccination and help you maintain that immunity for a longer period of time. So ideally, you want to receive that second dose as scheduled, and that's 3 to 4 weeks out, depending on the first vaccine, which vaccine you get. But if you are delayed in receiving that second dose, you'll still be able to get it, and it will still work to boost your immune system. So it will be important to get that second shot. If you don't get that second shot, you'll probably have some immunity, but not as much as you would have had you completed the entire vaccination. And that immunity probably won't last for as long.
Okay, well, good to know. Now, if we do get the vaccine, can I stop wearing a mask and social distancing?
So not right away. We're going to still be stuck with masks for a while because um, we need to make sure that, although the vaccine is very effective, we don't know, could you get an infection, asymptomatic infection after you've had the vaccine that you could spread to others who are unvaccinated. So particularly early on, the population won't have yet been vaccinated, we'll still want to practice mitigation procedures like masking and social distancing just to protect others around us until we reach a level where there's, 70% of the population or so has immunity. And once we get to that point, we'll be able to put those masks in a back drawer.
Okay, and let me see. Someone had a question. How long is the time between the two shots? They probably missed that.
Yeah, so it depends on which vaccine you get. So it's either 3 or 4 weeks.
Now, I have a question myself.
Yeah.
Maybe you know, maybe you don't know. Like I know, because I've had COVID, and they tell you not to get tested for about 90 days after. So I'm like, how do they really know that that's something that's okay? And they tell you, okay, you're out of isolation, still practice your social distancing. Like, how does that make people comfortable if we're not really sure?
So when you're infected with COVID, in general, you need to self-isolate for 10 days. So unless you have really severe illness, you're thought to be really infectious for 10 days. And after that time, you shouldn't be infectious to others. What we are learning about the virus is that we know that immunity lasts probably for about at least 90 days. There have been some rare cases of people being reinfected with COVID. So we don't know that people who've had COVID develop permanent immunity. But we suspect that people who have had COVID, if it will be fine to get the vaccine, and will still be recommended, particularly if they've had COVID many months ago, to get the vaccine at some point when it becomes available for them.
Oh, well, that's great because a lot of people are like, well, they said this and they said, I'm like, I don't know, but if some people feel a little more comfortable with those people who, are in there like 90 days, and I'm like, I still don't know. I still wear your mask, still keep your distance, and because at the end of the day, as much as they say we don't know, who knows? You know what I mean? It's like super
We're learning more all the
as we go.
time. There science is tricky because although we can say what happens for most individuals, there's obviously always a spectrum, and so not everything's 100%. So
Right.
we want to be careful and use the knowledge we have to kind of best we can.
All right. And I have another question. If the vaccine starts rolling out to certain populations this month, do you have any idea when the pandemic will end and life will return to normal?
Yeah, I think we're all hoping that we can get to a place by this summer that there'll be more herd immunity and we'll start getting to normal activity. A lot of that's going to depend on how quickly people are able to get vaccinated and how good the uptake is around the vaccine. So I think really, you know, it's a little bit wait and see. I think there's good reason to be hopeful, but we don't completely know yet.
Right. Yeah, I mean, I usually tell people, you know, if they know they have to be around someone and they know they still have to go out and work, just to be cautious about, you know, not speaking up. I usually, if I'm somewhere I can't be too far from someone, I try to speak toward the ground. That way, if, you know, if any spit is coming out, it's going to the floor, or, you know, keeping my hands really clean. I have my hand sanitizer in all my bags just in case. Like, you can see I have like my little face shields, and like I have 85,000 masks. You don't understand. I have a mask to match every single color you can imagine. But I mean, yeah, it's crazy.
Yeah.
Well,
I think the masks really do work. They're great, but I know we will all look forward to a time where we can gather together with friends and safe and do so. You know, I really am excited about the vaccine, and I hope that people are able to get vaccinated quickly, and we just will do our best to do that.
yeah, I hear you. And do you have anything else you want to mention, or some other information you'd like to share with us?
No, I just encourage people to ask questions. I think there's a lot out there. You know, these vaccines, I will say, as you know, the science geek in me, these incredible stories of discovery. And although you're hearing a lot about Pfizer, one of the interesting little tidbits to know is that really the people who invented the Pfizer vaccine have their little company called BioNTech. And they're a couple who run this company. They're a Turkish couple. They live in Germany. They were both immigrants, and they have spent their whole lives trying to cure cancer and develop this technology. When they saw the start of the pandemic in January, you know, this is going to be a really important. We have to put down everything we're working on this and design. And we're able to work with Pfizer, a large company, to distribute it. Really an immigrant success story, and just an incredible scientific achievement. And same with Moderna. I mean, Moderna is a little teeny company in Cambridge, Massachusetts. They've been working on other virus vaccines for the 10 years. This is going to be their first vaccine coming to market. They've worked on other vaccines such as Ebola. So it's a great scientific achievement. And really a lot of people worked very hard together to do this.
Oh, well, definitely a big highlight shout out to them. Like, you know, putting everything down and just starting to like focus on this specific thing to try and take care of us, the people. It's a super, super big deal. And we're so happy that they are doing that, you know, to take care of us and to try to make us back to normal lives again.
Mm-hmm.
But yes, let's see. I don't think we had any other questions. Somebody said, thank you so much for all the clear information and responses. So yes, that thank you so much. So if we don't have any other questions, don't forget Whitman-Walker is still open for HIV and STI testings by appointment at our Liz location in Northwest DC and our MRC location in Southeast. To make an appointment, you can call 202-797-4439. Social distancing is the way to reduce the amount of COVID-19 transmissions. It deliberately increases the physical space between people to avoid spreading the illnesses, especially around the holidays, where many people are used to traveling. Make sure that you are staying at least 6 feet away from people when possible. Wear your mask in public. Avoid places with large crowds. Encourage work from home if possible. Speaking to your loved ones over the phone or FaceTime or going on lives with your friends is super fun. So you can like share with all that internet out there, right? Speaking with your loved ones FaceTime. Social distancing is caring for your community. Stay up to date on your local, state, and national guidelines for testing, quarantine, and general safety. Washing your hands for at least 20 seconds at a time. Staying home if you don't feel well. Don't forget to follow Whitman-Walker on Instagram, Facebook, Twitter at Whitman-Walker, and also Real Talk DC _ to stay up to date with Whitman-Walker Health and any updates. We are going live every week, so stay tuned with Whitman-Walker. We have other social media influence. Thank you so much, Dr. Henn.
Thank you.
So nice to meet you, and we'll hopefully see you soon and giving us better news, right?
Yeah, absolutely. We're going to have to program live our first shot vaccine once we get it.
Yes, I'm gonna go live when I get mine too, just to show them. Hopefully, everything will be okay. Well, thank you so much. I hope to see you soon, and you take care and have a great weekend.
You too. Take care.
Thank
Bye-bye.
you, everyone. Have a great day.